Assalamu alaikum wa rahmatullahi wa barakatuh. Ramadan Mubarak. The Mashayikh received too many questions on Ramadan and they are repeatedly asked. So in this video, inshallah, it's going to be very short. I will tell you, inshallah, all what you need to know on Ramadan. On whom is incumbent to fast Ramadan? The pubert, the resident, not the traveling one, the sane, and the capable. And also free of nullifications like sickness, like the ones who travels, the menstrual women, the postnatal bleeding, childhood. Now, what are the things that invalidate fasting? The things that invalidate fasting are eating or drinking from dawn until sunset, menstruation, postnatal bleeding, and also sexual intercourse. And vomiting deliberately. Not to forget that copying is differed upon, better not do it in Ramadan. There are other related things to the aforementioned, like the drops, whether they are feeding or not. If they are feeding, also the injections, they are prohibited. If one is obliged, like our brothers and sisters in Uyghur, Muslims, they are obliged, they do only qada without kafara. The ones that are exempt from fasting are the menstrual women, the sick, the elder people, and the traveling people. The one who travels is allowed to eat, whether he can fast or not. He's allowed to do that, whether on plane, on camel, or any means of travel. Let's talk on the sick case. Concerning the sick, if it's only slight migraines or slight flu, then he's not allowed to eat. But if this harms his health, then he's allowed to eat according to the doctor. So his mufti is the doctor in this case. And the sick who eats, he is to make up for the days he ate without kafara. If the disease is chronic, then he feeds 1 pour a day, which means 30 pour. And of course, do not follow the Qadianis, the Ahmadiyya between parentheses, who say that you feed 2 pour. In Islam, in Sunnah, in Quran, you feed only 1 pour, as it is mentioned in Quran. And as for the elder, he has the same hukum of the sick. Now, fatwas for women. If a woman eats because of menstrual blood, she makes up for the days she ate without kafara, without feeding the poor actually. How about the chronic blood, istihada? In this case, it does not invalidate fasting and the woman has to fast. How about contraceptives? They are allowed. And the pregnant women or the breastfeeding women, they have the same hukum as the sick. They do qada without kafara, which means it's allowed for the pregnant and the breastfeeding women to eat, then do qada. Now, concerning the medicine that you take from the mouth, the tablets that are put under the tongue because of heart crisis, they are allowed. Concerning asthma sprayers, they are allowed. Medicine, rinsing, they are allowed as long as they don't reach the throat. And these are some rulings on the drops. Concerning the medicine or the medical drops that are put from the nose or the mouth, they invalidate fasting. And as for the drops that are put in the eyes or in the ears, they are permissible and they don't invalidate the fasting. We move to the ahkam of blood. Taking blood for analysis is permissible. Donation of blood is permissible as long as the amount is not too much. Yet, blood injection is impermissible. As for the hijama, we said it's differed upon. Better leave it in Ramadan during fasting. Now, we move to the ahkam of the teeth. Concerning the endodontics, they are permissible. Toothpaste, permissible. The miswak, permissible. Also, removing the tooth does not affect your siyam. Laser treatment does not affect the siyam, and implanting the teeth does not affect the siyam as long as you don't swallow any liquids. The dialysis do not affect the siyam. All camera insertions do not affect the siyam. The diabetics injections, they do not invalidate the siyam as long as they are not feeding, and washing yourself does not invalidate the siyam. Barakallahu feekum. Please share this video, very brief, and it contains all what you need to know, inshallah. You don't need now to ask questions on Ramadan because you have the general rules.